Hello, welcome to this channel and thank you for stopping by. In this channel, I feature videos dedicated to providing information related to psychological principles and concepts. In this particular video, I'm going to give you 100 psychological disorders and psychotherapies multiple choice questions and answers. If this is your first time to visit this channel, I urge you to subscribe. And if you are a returning subscriber, I thank you again for visiting us. Without wasting much of your time, I would like to go to the first question and all the other questions related. Thank you. So, number one, systematic desensitization is a form of psychotherapy most closely associated with the work of A. Joseph Welp, B. Carl Rogers, C. Albert Ellis, D. Jacob Romano. When you look at the four options, the correct answer here is Joseph Welp. He's the one who is associated with systematic desensitization. If you remember from your notes, Carl Rogers was a humanist and Albert Ellis was a cognitive behaviorist. Number two, the primary feature or features of catatonic schizophrenia is A. Motor abnormalities, B. Auditory hallucination, C. Inappropriate affect, D. Paranoia. When you look at the four options, you realize that catatonic schizophrenia is a subtype of schizophrenia that is characterized by motor abnormalities. So the correct answer here is A. Well, all the other options are not, may be related one way or the other to catatonic schizophrenia. The primary feature is motor abnormalities or psychomotor disturbances. So the correct answer here is A, number 2. The technique used to extinguish fear by forcing the patient to remain in the anxiety arousing situation is called A. Inhibition, B. Flooding, C. Desensitization, D. Implosion. The correct answer here is flooding. This is the technique that is used to extinguish fear by forcing the patient to remain in the anxiety arousing situation. Number 4, the client-centered therapy of Carl Rogers differs from Freudian therapy most substantially in that the Rogerian therapist A refers to the patient as the client, B is more directive, C does not emphasize stressing the development of the client's personality from the earliest beginnings, and D does not attempt to be as observant as a psychoanalyst. The correct answer here is C. The therapist does not emphasize stressing the development of a client's personality from its earliest beginnings. You realize that Freudian therapy or psychodynamic therapy emphasizes that most of the psychological disorders emanate from childhood, that is, from the earliest beginnings of a client. So, number 3 is C. Number 5, the wife of Mr. Jones, an extremely hardworking man with a stressful occupation, reports to the police that he has been missing for 2 days. Investigations reveal that Mr. Jones is now living in a different city under a new name and cannot recall his former identity. Mr. Jones is most likely to be suffering from A. Dissociative fugue, B. Identity disorder, C. Dysmorphic disorder, D. Obsessive compulsive disorder. So when you look at the four options, you realize that the condition which Mr. Jones is suffering from is dissociative fugue. You remember that dissociative fugue is a rare disorder, and a rare disorder that is associated with amnesia. And in this case, the individual with dissociative fugue may unexpectedly and temporarily lose his senses and may wander away from their usual environment to another environment. So this is the correct answer when you look at the assertion that Mr. Jones is now living in a different city and cannot recall his former identity. So the correct answer here is dissociative fugue. Number 6. Which of the following concepts is least directly related to psychotherapeutic technique? A. Systematic desensitization. B. Retroactive inhibition. C. Flooding. D. Implosion. Which of the following concepts is least likely related to psychotherapeutic technique? When you look at the 4 options, you realize that the correct answer here is retroactive inhibition. This is the technique that is least directly related to psychotherapeutic technique. You realize all these other options are related to various therapeutic techniques. So the correct answer here is B. Number 7, phobias are usually treated most successfully through the technique of dash. A. Psychoanalysis. B. Systematic desensitization. C. Transactional analysis. D. Client-centered psychotherapy. Phobias are usually treated most successfully. You realize that all the options can be able to be used in trying to treat phobias, but the most successful treatment or technique that is applied to phobias and anxieties is systematic desensitization. So the correct answer here is B. Number 8, the unconscious process most closely associated with the phenomenon of transference is A. Displacement. B. Sublimation. C. Reaction formation. D. Fixation. The unconscious process most likely associated with the phenomenon of transference is displacement. So number 8, the correct answer is A. In contrast to bulimia, anorexia is characterized by A. Binge eating. B. Fear of gaining weight. C. Repeated purging. D. A refusal to maintain a minimum normal body weight. So when you look at this, all the options, you realize the correct answer is D. And you have to realize that both bulimia and anorexia are eating disorders. While B may look to be the correct answer, D is correct in that one refuses to maintain the minimum body weight, and all these, by trying to maintain a minimum body weight, may also be associated with a fear of gaining weight. Number 10, which of these illnesses is related to abnormality in the dopaminergic system? A. Schizophrenia only. B. Parkinson's disease only. C. Alzheimer's disease only. D. Parkinson's disease and schizophrenia. The correct answer is D. Which neurotransmitter is inhibitory? A. Epiphrine. B. Dopamine. C. Serotonin. D. GABA. When you look at all the options, you realize that the correct answer is D. GABA is a neurotransmitter of the brain in the brain that plays a crucial role in regulating neural activity and is inhibitory. And when you look at serotonin regulates mood and sleep, while dopamine is associated with pleasure and reward and issues related to motivation, and epinephrine is an adrenaline, a hormone as well as a neurotransmitter that is related to the fight and flight mode. So the correct answer here is D. Number 12, which are a key feature of the DSM-4 is that it's A, focuses on the etiology of mental disorders, B is a multi-scale system of assessment, B focuses on the theoretical issues, D is a behavioristic in our outlook. The correct answer here is B. This is a multi-scale system of assessment. So the correct answer is B. The most severe forms of mental retardation tend to be associated with A, low socioeconomic status, B, physiological damage to the brain, C, malnutrition, D, cultural familial retardation. The most severe forms of mental retardation tend to be associated with physiological damage to the brain. If the brain is a physiological damage, that may affect and may contribute to severe forms of mental retardation. Number 14, a man comes to a clinic complaining of persistent worrisome thoughts and nervousness that interferes with his work. The condition is known as A, dissociative disorders, B, generalized anxiety disorders, C, schizophrenic disorders, D, obsessive compulsive disorders. You realize that the man will be complaining of persistent worrisome thoughts and nervousness that interferes with his work. So this may be associated with generalized anxiety disorders. It's generalized in that the person has got several worrisome thoughts and nervousness. So the correct answer is generalized anxiety disorder. The fundamental rule of psychoanalysis is that the patient is to say whatever comes into your mind, no matter how embarrassing or trivial this might appear to be. This best describes A, transference, B, countertransference, C, free association, D, projection. So when you look at psychoanalysis, and one is obliged to talk whatever comes into his or her mind, no matter how embarrassing or trivial. This is associated with free association, whereby one will be talking whatever comes to mind without any interference. Number 16. Solomon has conducted a classic experiment in which he asked a group of college students to decide which of the three lines was equal in length to a standard line. This was studying A, MA exposure effect, B, conformity, C, social facilitation, D, reference groups. The correct answer, when you look at Solomon asks experiment, the correct answer here is conformity. He did an experiment to look at conformity, so the correct answer is B. Number 17, client-centered therapy is the cornerstone of the DASH approach to therapy. The behavioral, cognitive, humanistic, psychoanalysis. Client-centered therapy is the cornerstone of which approach to therapy? The correct answer here is humanist. So when you talk about client-centered therapy, we're talking about theorists like Maslow and Carl Rogers, predominantly Carl Rogers. So client-centered therapy is the cornerstone or foundation of humanistic approach to therapy. According to Carl Rogers, the goal of therapy is to A, self-actualization, B, internal loss of control, C, congruence, D, self-satisfaction. According to Carl Rogers, the goal of therapy is to achieve internal locus of control. So the correct answer is B. Number 19. Which of the following personality disorders is associated with a pervasive pattern of detachment from social relationships and a restricted range of emotional expression? A, schizoid, B, narcissistic, C, histrionic, D, antisocial. The correct answer here is schizoid. This is the personality disorder that is associated with a pervasive pattern of detachment from social relationships, as well as a restricted range of emotional expressions. The correct answer is A. Number 20, which of the following is not? So the keyword here is not an example of a primary prevention of mental illness. A, prenatal health care. B, narcotics anonymous. B, genetic screening. D, drug abuse resistance education. Which of the following is not an example of primary prevention of mental illness? The correct answer here is Narcotic Anonymous. B. Narcotic Anonymous is related to issues of individuals who will be abusing narcotics and is not an example of a primary prevention of mental illness. So number 20, the correct answer is B. Albert Ellis Rational Emotive Therapy, RET, is an example of A, psychoanalytic therapy. B, humanistic therapy. C, existential therapy. D, cognitive behavioral therapy. Albert Ellis Rational Emotive Therapy is an example of, the correct answer is cognitive behavioral therapy. Number 22, the therapist feels she can no longer treat a hypochondriacal patient because the secondary gain is too great to overcome. This means A, the symptom is reducing the tension of conflict. B, the advantages derived from the illness outweigh the discomfort created by the illness. C, the ongoing mental retardation is directly related to the id and characteristic of unconscious mental activity. C, D, the ongoing mentation is primarily related to the functions of the ego and pre-conscious thoughts. The correct answer here is B. The advantages derived from the illness outweighs the discomfort created by the illness. So the correct answer is B. All the following terms are associated with client-centered therapy, except, so it means of all the given options, only one of them is not related to client-centered therapy. A, empathy. B, unconditioned positive regard. C, will to power. D, positive trusting environment. Which one of the following is not? Which of the following are associated with client-centered except? So the correct answer here is will to power. You realize that empathy, unconditioned positive regard, and positive trusting environment are all related to client-centered therapy. Number 24, a man was picked up by the police 100 miles from his home, reporting to be some other than who his identification named. A mental status examination showed that he was quite confused. The most likely diagnosis would be A, catatonic schizophrenia. B, identity disorder. C, psychogenic amnesia. D, psychogenic fugue. The correct answer here is psychogenic fugue. Which of the following is a negative symptom of schizophrenia? A, perceptual hallucinations. B, delusions. C, flat affect. D, disorganized speech. Which of the following is a negative symptom of schizophrenia? The correct answer here is flat affect. Which of the following is not a technique used in Freudian therapy? A, free association. B, free recall. C, dream interpretation. D, analysis of transference. The correct answer here is free recall. You realize that all the other three options are techniques that are used in Freudian therapy. The term reaction formation is most likely to be encountered in the description of DISH. A, group therapy. B, behavior modification. C, psychoanalysis. D, psychodrama. The correct answer here is psychoanalysis. In a psychoanalytic case study, Taibu criticizes his brother, Semi's tendency to steal things when in fact Taibu, not Semi, has been caught shoplifting on several occasions. According to psychoanalytic theory, Therapy is most likely displaying which of the following defense mechanisms: A. Repression, B. Compensation, D. C. Rationalization, D. Projection. The correct answer here is projection. Delusions are a major symptom of A. Somatoform disorders, B. Personality disorders, C. Substance-related disorders, and D. Schizophrenic disorders. Delusions are a major symptom of schizophrenic disorders. According to Freud, resolution of the Oedipal complex: A. has no analogous process in girls, B. depends on the antipathy of the child towards the father, C. is a sign of the emergent genital sexuality, D. is marked by a sublimation of libidinal energy. The resolution of the Oedipal complex is, according to Freud, the correct answer here is marked by a sublimation of libidinal energy. Disturbances in the nerve tracts for certain neurotransmitters has been linked with various psychiatric disorders and degenerative diseases. Which of the following pairing is not correct? A. Dopamine and schizophrenia, B. Serotonin and mania, D. GABA and Parkinson's disease, D. Norepinephrine and depression. The correct answer here is GABA and Parkinson's disease. Remember, GABA is a neurotransmitter that is inhibitory effects. Number 32. Dysmetric disorders are A. Mood disorders, B. Sexual disorders, C. Somatoform disorder, D. Schizophrenic disorder. The correct answer is mood disorders. Current trends in mental health do not include A. Stepping up emphasis on outpatient care, B. Greater emphasis on community mental health centers, C. Construction of large state hospitals, D. Group therapy. Current trends in mental health do not include the construction of large state hospitals. Number 34. It treats symptoms rather than the causes. This is a criticism commonly leveled at A. Psychoanalysis, B. Implosion therapy, B. C. Behavioral therapy, and C. Transactional therapy. It treats symptoms rather than the cause. This is a criticism commonly leveled against behavior therapy. So number 34 is C. Among first admissions to public mental hospitals, which one of the following diagnoses is most prevalent? A. Schizophrenic reaction, B. Alcoholic addiction, C. Somatoform disorder, D. Cerebral artery cirrhosis. Which one of the following is most prevalent? A. Schizophrenic reaction. So the correct answer is 35 is A. If the Veterans Hospital plans to implement a technique known as flooding, within this approach, the veterans will vividly relive and re-experience the traumatic events they went through during combat. Flooding would be technically described as A. Client-centered therapy, B. Systematic desensitization, C. Implosive therapy, D. Counter-conditioning. The correct answer is implosive therapy. Which form of schizophrenia contains delusions of grandeur or persecution? A. Residual, B. Disorganized, C. Catatonic, D. Paranoid. Which form of schizophrenia contains delusions of grandeur or persecution? The correct answer here is paranoid. Which of the following could lead to psychopathology? A. Fear of failure, B. Self-actualization, C. Self-confidence, D. Self-direction. Which of the following could lead to psychopathology? The fear of failure. Enuresis or bedwetting. A. is a poor prognosis, B. is most common among adults, B is more common among women than men. D can be a result of faulty parental discipline. Enuresis or bedwetting. The correct answer is D. It can be a result of faulty parental discipline. Number 40. The man walking to work counts the cracks in the sidewalk. Although he is almost to his office, he fears that he is miscounted and so returns to the wagon terminal to begin counting again. This behavior is known as A. Schizophrenic reaction, B. Psychopathic disorder, C. Conversion disorder, D. Obsessive compulsive disorder. Which of the following can account for this behavior? The correct answer is obsessive compulsive disorder. This is because the men will have an obsession to continuously make sure and will be inclined to repeat several behaviors in an obsessive manner. So number 40, the correct answer is D. Number 43, a man went off on a fishing trip and lost all the memory of who he was. Years later, his original family, who had presumed him dead, read a newspaper article about a citizen award he had received in another community. This is a case of A. Fugue, B. Identity disorder, C. Amnesia, D. Personality disorder. The correct answer is fugue. This is whereby one loses memory of past experiences and may go to another location and forget about his past. DSM-IV is organized along how many exists? 2, 3, 4, 5. The correct answer is 5. Because mentally disturbed individuals were believed to be possessed by evil spirits, early treatments included A. Flogging, B. Starving, C. Burning, and D. All of them. The correct answer here is all of these concepts were part of early treatments that were given to people who were mentally disturbed. Number 46, within the current diagnostic system, post-traumatic stress disorder is classified as A or N, A, mood disorder, B, anxiety, C, delusional, D, dissociative. What classification is post-traumatic disorder classified under the current diagnostic system? The correct answer here is delusional. It is classified as a delusional disorder. When we speak of Down syndrome or other syndrome, the term refers to A, substance-related disorder, B, a teratogenic disorder, C, a state of mental confusion, D, a set of simple symptoms generally occurring together. This is the correct answer. According to cross-cultural studies, the incidence of schizophrenia is most prevalent within the dash class. A, upper, B, upper middle, C, lower, D, lower middle. According to cross-cultural studies, the incidence of schizophrenia is most prevalent within the lower classes. So the correct answer here is C. The most radical form of therapy ever provided for people is A, systematic desensitization, B, client-centered therapy, C, psychosurgery, D, primal scream therapy. The most radical form of therapy ever provided for people is psychosurgery. This is the most radical. The key word here is radical. Number 50, sleepwalking and talking. A, okay, primarily during the training period. B, signify hypnagogic activity. C, correlate strongly with incidents of alexia. D. Occur more frequently among women than men. Sleepwalking and talking occur more frequently among women than among men. So the correct answer here is D. The learned helplessness theory of depression has been the work of who? A. Rota, Seligman, Maslow, Bandura. The learned helplessness theory of depression has been the work of Seligman. Freud became familiar with the concept of talking cure through association with who? Chahal, Buret, Searle. Freud became familiar with the concept of talking cure through the association of pure. The person smokes a cigarette and because of earlier drug administration becomes nauseous in a technique known as A. Chaining, extinction, aversive conditioning, reciprocal inhibition. The correct answer is aversive conditioning. Which of the following would most accurately describe the delusional situation in which a person believes others are talking to him or her? A. Delusions of sin and guilt. B. Hypochondrial delusions. C. Delusions of grandeur. D. Delusions of reference. Which of the following was most accurately describe the delusional situation in which a person believes others are talking to him or her? The correct answer is D. Delusions of reference. Elevators seem to close in, and small rooms create feelings of fear that are seen as unbearable in persons who have this, unbearable in dash. A. Anxiety reaction, acrophobia, oculophobia, claustrophobia. Elevators seem to close in, and small rooms create feelings of fear and unbearable in claustrophobia. This is the fear of elevators and closed spaces. A person is completely unresponsive, stares blankly into space and never moves. This shows symptoms related to A. Paranoia, schizoaffective, C. Catatonic schizophrenia, D. Residual type of schizophrenia. This is a situation whereby one person is unresponsive, stares blankly into space and never moves. The correct answer here is catatonic schizophrenia. In Bandura's behavioral psychotherapy, a withdrawn child in a kindergarten room would be reinforced for A. Remaining alone, B. Joining the group, B. Drawing a picture and writing his name. In Bandura's behavioral psychotherapy, a withdrawn child in a kindergarten room would be reinforced for joining a group. In which of the following would spontaneous recovery be most likely? A. Paranoid state, B. Narcissistic personality disorder, C. Stuttering, and D. Antisocial personality disorder. In which of the following would spontaneous recovery would be most likely? The correct answer is paranoid state. This is where spontaneous recovery is most likely when you consider aspects related to the other options. Psychodrama is a form of which of the following managerial training techniques? A. Incident, B. Insensitive, C. Role-playing, D. Free association. Psychodrama is a form of which of the following managerial techniques? The correct answer is role-playing. Number 60. The least likely treatment procedure virtually extinct in today's psychiatric facilities is A. Electroconvulsive shock therapy, chemotherapy, individual psychotherapy, and prefrontal lobotomy. Which treatment is least likely to occur in today's psychiatric facilities? The correct answer is prefrontal lobotomy. This is not being used and was used before and is no longer in use. The therapeutic technique which is present in the work of Warp and not evident in Skinner's method is A. Positive reinforcement, negative reinforcement, C. Distinctive stimulus, and D. logotherapy, a technique that is present in the work of Warp and not evident in Skinner's method is logotherapy. Number 62, transvestism would be classified among A. Sexual and gender identity disorders, B. Anxiety disorders, personality disorders, and somatoform disorders. The correct answer is A. 16, different self-containing personalities within the same individual manifesting themselves at different times is a form of A. Anxiety disorder, catatonic schizophrenia, dysthymic disorder, dissociative disorder. The correct answer is dissociative disorder. Which of the following distinguishes anxiety from fear? A. Realistic environmental danger, B. Strength of emotion, C. Galvanic skin response, D. Blood pressure. Which of the following distinguishes anxiety from fear? The correct answer is realistic environmental danger. A characteristic of schizophrenia is A. Heightened awareness of reality, B. Eidetic imagery, C. Withdrawal from interpersonal relationships, D. Psychological paralysis in the portion of the body. Which is a characteristic of schizophrenia? The correct answer here is withdrawal from interpersonal relationship. Intense fear of open spaces is called ochlophobia, acrophobia, claustrophobia, agoraphobia. The correct answer is agoraphobia. This is an intense fear of open spaces, while the fear of closed spaces is claustrophobia. Transference and resistance are common in A. Psychoanalysis, B. Group therapy, behavior therapy, client-centered therapy. Transference and resistance are common in psychoanalysis. Depression is mild and includes within it no distortions of reality in A. Sleep disorder, B. Organic disorder, C. Mood disorder, D. Personality disorder. Depression is mild and includes it no distortions of reality. The correct answer here is mood disorder. Which of the following is believed to have an important role in mood disorders? A. Norepinephrine, B. estrogen, C. progesterone, D. acetylcholine. Which of the following is believed to have an important role in mood disorders? The correct answer is A. 70. Emotional problems are treated through role play in a role play technique in A. Psychodrama, B. Client-centered therapy, C. Impulsive therapy, D. logotherapy. Emotional problems are treated through role playing in the technique of psychodrama. The correct answer is A. Researchers have found the highest incidence of schizophrenia A. between frontal twins, B. between identical twins, C. between siblings, D. in urban areas. Researchers find the highest incidence of schizophrenia between identical twins. A form of group therapy in which the therapist lectures and leads discussions is A. inspirational, B. didactic, C. non-directive, D. abreaction. A form of therapy in which the therapist lectures and leads discussions is didactic. Number 73, long-term follow-up studies of patients treated through behavior modification technique indicate A. high rates of relapse among practical law patients, B. high rates of relapse among neurotic patients, D. high rates of relapse among hypochondriacal patients, D. few relapse. Long-term follow-up studies of patients treated through behavior modification indicate few relapses. Number 74, a person expressing functional blindness could be experiencing A. dissociative disorder, B. somatoform disorder, C. anxiety disorder, D. Cleidothymic disorder. A person experiencing functional blindness could be experiencing somatoform disorder. Given limited funds and a limited time period, which of the following methods might be recommended for dealing with a phobic reaction? A. Psychoanalysis. B. Transcendental meditation. C. Systematic desensitization. D. Logotherapy. Given limited funds, so the funds are limited and limited period of time, it means there's no time for a prolonged psychotherapy, and the condition is a phobic reaction. When you look at all the four, you realize that most psychoanalysis takes a long period of time, the same with meditation and logotherapy. So the correct answer here is systematic desensitization, given that there is limited funds and there is limited time. Number 76. The psychoanalyst becomes the recipient of affection that the patient felt earlier in her life towards her father in A. Transference, B. Connotation, reaction formation, or complex. The correct answer is transference. This is whereby the client transfers feelings or behaviors to the therapist, that and those feelings and reactions and affections might have been directed towards another person. So the correct answer is transference. Which of the following does not express a dissociative disorder? A. Identity disorder. B. Fugue. C. Somatoform. D. Depersonalization. Which one of the following does not is the keyword dissociative disorder? The correct answer is somatoform. This is not a dissociative disorder. 78. In a psychiatric team, which one of the following would be the exclusive responsibility of the psychiatrist? A. Behavior modification. B. Electroconvulsive shock therapy. C. Psychodiagnosis. D. Group therapy. Which one of the following would be the exclusive responsibility of the psychiatrist? The correct answer is B. Electroconvulsive shock therapy. Which one of the following techniques places greatest emphasis upon the goal of making client aware of the totality of his behavior? A. Impulsive therapy. B. Logotherapy. C. Gestalt therapy. D. Ego analysis. Which of the following techniques places greatest emphasis upon the goal of making a client aware of the totality of their behavior? The correct answer is Gestalt. Remember, when we talk about Gestalt, we say the whole is greater than the sum of its parts. So when you are talking about the totality of client's behavior, we are talking about Gestalt therapy. The major affective disorders are characterized by A. Extreme and inappropriate emotional responses. B. Withdrawal and emotional distortion. C. Severe depression. D. Chronic experience of depression. The major affective disorders are characterized by A. Extreme and inappropriate emotional responses. A key component of paranoia is usually A. An organized delusional system with jealousy content. B. The presence of tactical hallucinations. C. The experiencing of vivid auditory hallucination. D. The presence of a dual personality. A key component. Key here means most important or pertinent component of paranoia is A. An organized delusional system with jealousy content. Modeling is a technique used in A. Behavior therapy, client-centered therapy, rational emotive therapy, and psychoanalysis. Modeling is a technique used in behavior therapy. Choose the word that does not belong to this set. Choose the odd one out. A. Amnesia, fugue, identity disorder, schizoaffective disorders. Which one is the odd one out? Schizophrenic, schizoaffective disorders. Someone who repeatedly washes his hands even when they are not dirty may be said to be suffering from a conversion reaction, an obsession, a compulsion, a phobia, escaping from being oneself. Someone who repeatedly washes his or her hands even when they are not dirty may be said to be suffering from a compulsion, that is, compulsive obsessive disorder. The behavioral modification technique that uses repeated exposure to aversive stimuli and disturbing scenes to extinguish the emotional responses associated with those stimuli is said to be A. Systematic desensitization, B. Impulsive therapy, C. Reciprocal inhibition, D. Token economy system. A behavioral modification that uses repeated exposure to aversives to distinguish emotional associative to that stimuli is called to be a token economy. Psychodrama is a form of group therapy in which participants act out of their feelings as if they were actors. Was introduced by A. Frankel, B. Jung, C. Erickson, D. Moreno. The correct answer is Moreno. He is the one who introduced psychodrama. Aversion therapy would be used for which of the following problems? A. Alcoholism, B. Paranoia, anxiety, D. Phobias. Aversion therapy would be best used in the following problems. The correct answer is alcoholism. Free association is the cornerstone of Dash approach to therapy. A. Humanistic, B. Psychoanalytic, D. Neurobiological, D. Behaviorist. Free association is the cornerstone of psychoanalytic approach to therapy. Which of the following is not one of the categories of dissociative disorders according to the DSM-4? A. Psychogenic amnesia, B. Identity disorder, C. Catatonic schizophrenia, D. Psychogenic fugue. Which of the following is not one of the categories of dissociative disorders according to the DSM? The correct answer here is catatonic schizophrenia. Parkinson's disease is a gradual degeneration of a particular part of a serotonin-containing axons, B. dopamine-containing axons, C. motor neuron, D. acetylcholine-containing axons. The correct answer is B. Dopamine-containing axons. All the following are often psychosomatic disorders except A. Hypertension, B. Gastrointestinal disorder, C. Paranoia, D. Migraines. All the following are psychosomatic disorders except. So it means of all these three, one of them is not the correct one. So which one of the following is the correct answer? Is paranoia is not one of the psychosomatic disorders. In children, the presence of a bizarre repetitive activities, a fascination with unusual objects, and an obsession with maintaining the sameness of their environment are signs of A. Hyperactivity, B. Obsessive compulsive disorder, C. Autism, D. Mania. In children, the presence of a bizarre repetitive activities and a fascination with unusual objects and an obsession with maintaining the sameness of their own environment are signs of autism. An individual who goes blind suddenly yet seems unconcerned about his dramatic loss and shows no underlying organic reason for the loss is probably suffering from A. Dissociative disorder, B. Conversion disorder, D. Occipital phobia, D. Post-traumatic stress disorder. An individual who goes blind yet seems unconcerned with this dramatic loss, shows no sign of underlying organic reason for the loss, is probably suffering from conversion disorder. A behaviorist would contend that depression is caused by A. Unconscious conflicts, B. Failure to become self-actualized, C. Failure to learn the proper way to behave, D. Society labeling people as abnormal. A behaviorist will be content that depression is caused by, the correct answer here is C. Failure to learn the proper way to behave. Which of the following is not an anxiety disorder? A. Social phobia, B. Panic disorder, C. Manic depression, D. Agoraphobia. Which of the following is not an anxiety disorder? When you look at the options, you realize that manic depression is not an anxiety disorder. All these other ones, social phobia, panic disorder, are all types of anxiety disorders. Which of the following is not a common symptom of anxiety disorders? A. Hallucinations, B. Illusion, C. Delusions, D. Bodily complaints. Which of the following is a common symptom of anxiety disorders? Correct answer here is bodily complaints. These are common among anxiety disorders. Which of the following concepts are closely related? Thought disorders and schizophrenia, identity disorder and schizophrenia, hallucination and depression, amnesia and catatonia. Which of the concepts are most closely related? The correct answer here is thought disorder and schizophrenia. Which of the following is not a characteristic of schizophrenia? A. Hallucinations, B. Delusions, C. Aberrant speech, D. Extreme mood swings. Which of the following is not a characteristic of schizophrenia? The correct answer here is extreme mood swings. These are not part of and are not characteristic of schizophrenia. Suppose that a housewife comes to a therapist complaining of extreme fear about leaving her home based only on this information. What would the therapist's preliminary diagnosis be? A. Free-floating anxiety, B. Agoraphobia, C. Social phobia, D. Depression. Based on this information, what would be the therapist's preliminary diagnosis? The correct answer here is agoraphobia. The final question: which of the following concepts are most closely related? A. Client-centered therapy with psychoanalysis, aversion therapy with insight therapy, implosion therapy with catharsis, token economy with positive reinforcement. Which of the following concepts are most likely related? The correct answer is token economy and positive reinforcement. Thank you for watching this video and spending time with me from the first question to the last question. And if this is your first time to come to this channel, I urge you to subscribe and to like this video. And if you have any comments, if you feel there are certain concepts or certain questions that I have wrongly given the answers, you are free to comment and to share with others who might find this video useful in their studies as they try to learn this wonderful subject of psychology. And if you are a returning subscriber, thank you for the support that you are giving to us. You never know how much we appreciate your support. And thank you so much, and may you keep on supporting us, and thank you so much.